Good afternoon. We're here with Dr. Jill Chilcoat. She is the radiologist and medical director at the Virginia Clay Dorman Breast Care Center here at Texas Health Southwest. And she just finished up a Being Well lecture where she talked about breast care and the risks of breast cancer in women and men as well. So thank you so much for joining us, and we're excited to have you here and that you joined in with the lecture. And we're going to ask some of the questions that came up at the Q&A after the lecture. We're going to go ahead and ask some of those to Dr. Chilcoat. So again, thank you for joining us.
Thank you, Clint. Glad to be here.
Of course. So one of the first ones that came up was, when should I start screening mammography and how often?
It's one of my favorite questions, and it's so important. For women of average risk, we always recommend that those ladies start mammography at age 40 and that they have annual mammograms from then on. As long as you're in good health, we recommend you continue annual mammography. We do not recommend that ladies wait past age 40 or that they go at longer intervals than 1 year. So again, beginning at age 40, annual mammograms, and as long as you're in good health.
Good. Okay. Well, that's good to know. That's good information to know. What's the difference with 3D mammography? I've heard lots of people have heard a bunch about 3D mammography, and does insurance actually cover it? And what really is the difference between that and the normal screening mammography?
So it's one of my favorite events in radiology. I love 3D mammography. It's actually what we call tomosynthesis. That's the medical term for 3D mammography. And yes, most of the time insurance covers 3D mammography or tomosynthesis. It's amazing technology. Instead of 4 views of breast tissue, we used to take a top to bottom, a side to side view of breast tissue. Now we take a book of pictures in each view. So we get many pictures, and that allows us to really get much more detail. And instead of finding cancers this big, we find them this big, like little pebbles. We're seeing cancers as small as 2 and 3 millimeters, which is amazing, and is all because the availability of tomosynthesis. We automatically perform tomosynthesis here at the Virginia Clay Dorman Breast Center in patients who we believe their insurance covers the 3D mammography. There are some carriers, some out-of-state carriers, and TRICARE for now does not necessarily cover it. You should check with your carrier if you happen to fall into one of those categories. But there is word out there that all will be covering it eventually. So we're all hopeful for that. We as radiologists excited about everybody getting tomosynthesis.
Well, that's great. Would you say that 3D mammography has helped with early detection as opposed to the old school version of mammography?
Absolutely. And the old school version of mammography, as you put it, is still an amazing tool. It has decreased mortality. It has made a huge difference for women. It is one of the few tools in medicine we can say without doubt has decreased mortality for breast cancer. But tomosynthesis is just better. It actually results in fewer callbacks, meaning the lady doesn't get as many false alarm callbacks for additional views, and it finds more cancers. It's documented that it finds tinier, more important cancers than we could find before. Instead of a cancer being hidden by dense tissue, that a little cancer might be buried in the dense tissue, now we can page through that dense tissue and find these little tiny cancers, which is amazing for us. So
that's fantastic. It really is. One of the last questions that came up today, a lady said, I've heard about some supplemental screening tools like breast ultrasound and breast MRI. Should I consider these options?
Well, yes, certainly in some cases. For ladies with dense breast tissue, breast ultrasound is a great tool. Even with tomosynthesis or 3D, as we've been talking about, there are some ladies whose tissue is just so dense that it's still very difficult to find some cancers. And ultrasound sometimes picks up things that we can't see with mammography. And so we believe that in certain instances, breast ultrasound is great. There's no radiation to a breast ultrasound, so that's one reason we love it. It's easy. It doesn't require any compression, so it's very comfortable. The lady's just laying down. We use little sound waves to find the abnormalities, and so it's an easy test for patients. Breast MRI is an amazing technology. It actually allows us to find cancers earlier than any other technology. It finds tiny, tiny cancers in ladies that we can't see the cancer on any other modality in some cases. So we definitely recommend that in ladies who fall into a high risk category. So ladies who have a risk, a lifetime risk level of greater than 20%, we recommend they have breast MRI and mammography yearly.
Wow, that's good. It's really good information, and we're so glad that you were taking part in the Being Well lecture series and that you were a part of this. And if you have more questions on our Being Well lecture series, be sure to go to texashealth.org/being-well. You can find more information about these types of lectures that happen all across the Metroplex. Again, we're so glad that you joined us, and so glad you joined us too, Dr. Chilcoat.
Thank you, Clint. Enjoyed it. Thank you.
Thanks.
Mm-hmm.